In this video, I will be addressing two surgical procedures, a meniscus repair and a partial meniscectomy. Both procedures are minimally invasive and are used to address some lesion that has occurred in the meniscus. A meniscus repair is when the lesion is sutured together, whereas the goal of a partial meniscectomy is to clean up or remove part of the meniscus where the lesion has occurred. First, I'm going to talk about the repair, and then I'll get into the meniscectomy later in this video. A meniscus tear is the most common reason for a person to undergo a meniscus repair surgery, and it's most commonly a sports-related injury such as twisting on a planted foot or contact made at the knee when the lower extremity is planted. The incidence of meniscus tears is 66 per 100,000 knee injuries, and they are more common in men and mostly occur in younger active populations. The post-surgical precautions and contraindications of a meniscus repair will largely depend on the surgeon and the protocol used, and therefore will have a direct effect on your ability to perform a full examination. Traditionally, the patient will be placed on non-weight-bearing status for 6 weeks. However, there has been a recent push for a more conservative approach that allows patients to be partial weight-bearing or even weight-bearing as tolerated. In either case, the patient will be placed in a knee immobilizer that must be used during ambulation. The most important thing for you as a therapist is to understand the protocol and adjust therapy as appropriate. For the exam, passive range of motion is appropriate, however, active and resisted movement testing is not, as we do not want to compromise the sutured meniscus. Passive knee flexion and extension will be limited due to pain and swelling. You will want to assess the patellar position, as the patella may have been pulled out of optimal alignment due to tight quadriceps. This will be important when we introduce quad strengthening exercises. Palpation will reveal tenderness and warmth and swelling due to inflammation. Neurodynamics are not indicated, and as this is a surgery, there is no need for special tests. Now moving on to the meniscectomy. It is most commonly utilized for cleaning up degenerative changes associated with osteoarthritis, and therefore it's more common in adults greater than 60 years of age, and it affects men more than women. The post-surgical protocol for a meniscectomy is largely unrestricted since the compromised tissue is no longer present. Therefore, you are able to perform a full examination using your patient's pain as your guide. Both active and passive range of motion will be restricted due to pain and swelling. Contractile unit tests are actually not indicated, as the musculature around the knee was never a source of the injury. Palpation will again reveal tenderness, warmth, and swelling due to the inflammation. Again, neurodynamics are not indicated, and there is no need for any special tests. Signs and symptoms that would indicate referral back to the physician would be any complications with the incision site, such as poor closure, any sign of infection, or a suspected DVT.